Hundreds of thousands of government workers are now expected to go on furlough as Congress fails to pass a funding bill, leading to a government shutdown early Wednesday morning. Who's to blame? Who will voters blame? And what are the policy stakes in the debate over government healthcare programs and Obamacare subsidies in particular?
From the opinion pages of the Wall Street Journal, this is Potomac Watch.
Welcome, I'm Kyle Peterson with the Wall Street Journal. We are joined today by my colleagues, editorial board member Kate Batchelder Odell and columnist Alicia Finley. The fourth government shutdown in about a dozen years officially began in the wee hours of Wednesday morning after a bill to extend current government funding levels failed in the Senate on Tuesday night, a vote of 55 to 45 short of the needed 60 votes. Three Democrats notably voting yes, with Republicans Maine's Angus King, Nevada's Catherine Cortez Masto, and Pennsylvania's John Fetterman. Angus King then explaining in a video, here he said, the irony, the paradox is by shutting the government, we're actually giving Donald Trump more power, unquote. The two sides are now jockeying here on Wednesday morning about the potential paths forward. Let's start with the Republican Senate Majority Leader, John Thune.
Chuck Schumer, at the behest of a bunch of liberal, far-left activist groups, has walked his Democrat colleagues into a boxed canyon. There's no way out, folks. There's no way out. This could have been avoided. It's totally unavoidable. And everybody's now asking the question, how does this end? Well, it ends when the Senate Democrats pick this bill up, passed by the House of Representatives, and vote for it.
And here on the Senate floor this morning is Democratic Minority Leader Chuck Schumer.
It's clear that the way out of this shutdown is to sit down and negotiate with Democrats to address the looming healthcare crisis that faces tens of millions of American families. Democrats want to avert this crisis, but Republicans tried to bully us, and it's clear they can't. They don't have the votes. The way out of this is for Republicans to finally roll up their sleeves and get to work.
To start with just what happens from here, essential government employees are still required to report and do their jobs, provide security, and so forth. The percentage of employees on furlough seems to vary pretty widely. Some reports saying that it's about 90% on furlough for the Environmental Protection Agency and the Education Department, something closer to half for the Pentagon's civilian workforce, and then something like 5% for the Department of Homeland Security, 2% for the Treasury Department. The effects may vary. The Centers for Disease Control and Prevention is going to stop analyzing disease surveillance data. If the shutdown lasts through Friday, the Labor Department is not expected to release the monthly jobs report that it normally does. National parks seem like they are partially open, especially if they're outdoors, but visitor centers and interior sites like the Washington Monument expected to be closed. So if your family had their one trip to Washington, D.C. this week, sorry, Congress owes you an apology. One other thought here, Kate, is these furloughed workers generally receive back pay at the end of the shutdown for the work that they did not do during the shutdown. So there's not even any real savings that are associated with these shutdowns. After having gone through a couple of these, it seems like the old Yogi Berra line, deja vu all over again, but it's certainly no way to run a railroad, much less a government of a world power.
It's deja vu in some ways, but it's kind of got an interesting twist because, having covered Congress for some time, in the past, 10 years ago, it was Republicans who would try to provoke a shutdown by, for instance, making a fight out of Obamacare and trying to get President Obama to repeal his signature achievement. And that didn't work. And now you have this sort of odd moment in Washington where the Democrats have decided to import that playbook and see if it can work for them. And I think it quite clearly won't. Some interesting signs here that one is your note about the initial vote on the stopgap measure to keep the government open. 3 Senate Democrats joining to vote for that is pretty notable. I think that's a pretty strong sign that some Democrats are saying, sorry, Captain Chuck, we don't want to ride this ship all the way down. And Republicans only need 5 more Democrats to make the same conclusion. And, there's John Ossoff in Georgia in a race next year. There's 2 Virginia senators who have a Virginia gubernatorial race coming up who might not want to shut down. I mean, there's any number of reasons why Democrats could decide that it's not in their interest to keep the government shut down. And I think that's the case because I think that could be the case because, like I'm talking about this bizarre flipped politics here, what Democrats have essentially done is given the White House a lot of latitude to decide what in the government stays open. And Democrats are typically, their constituencies want the government to be open. They don't want the government to be smaller the way that the Trump administration does. So those are just a few of the reasons why I don't think a long shutdown is going to work for Democrats, even if they're just saying, oh, well, Republicans are in charge, so they own this. I think there are real problems with that.
Well, on that point about the positioning of the two parties and the flip from the past shutdowns, or at least some of them that we've had, Alicia, I agree that is part of the dynamic. I mean, you listen to the 2 Senate leaders at the top. John Thune says, we just pass this bill, we keep the funding levels flat, and then we negotiate, as we typically do toward the end of the year, on how to fund the government. And Chuck Schumer is the path forward is to sit down and give us what we want. And that has been, I think, the position of some of the Republicans in past years who have argued for shutdowns and prompted shutdowns. Kate mentions the one, I think, in 2013, when the Republican position was, if we just all stick together, we can get President Obama to sign a bill that will defund Obamacare. And that was never going to happen. But it is difficult. It is hard to be in the minority party. It is hard to go home to your constituents and try to explain to them what you're doing to stop the policies and the bills that you don't like, your party doesn't like, when you don't control the Senate and you don't control the House and you don't control the White House. So there's real frustration sometimes, I think, in the party base to do something. And we saw that when Chuck Schumer earlier this year in March, he did not prompt a shutdown. He helped Republicans continue to keep the government open at that point. And he got some blowback, I think, from progressives and Democrats who wanted Democrats in Congress to be taking a harder line. They want to see some fight out of their Democratic leaders, even if their Democratic leaders don't have the power to have much leverage at all.
I think that's right. This is mostly about posturing for Chuck Schumer. The progressive base wants him to resist and to put up, as you point out, a fight, namely over these enhanced Obamacare subsidies that were really a vestige of the pandemic. In the 2021 American Rescue Plan, recalled that they sweetened the Obamacare premium tax credits for basically everyone and extended their eligibility to people who were making over 400% of the poverty line. This was supposedly only intended to last for a couple of years during the pandemic or as long as COVID was going, to help people who had lost their jobs or were kind of transitioning or harmed in some way by the pandemic. That was really, in my view, never the intent. The intent was to do this, make this temporary expansion into a permanent full expansion of the entitlement state. And Democrats in 2022, the Inflation Reduction Act, surprise, surprise, extended these same tax credits through 2025. And they only did it for a few years because they were trying to minimize the cost of the Inflation Reduction Act on paper, because extending them or making them permanent would have been enormously expensive. So they only did it for a few years, and they say, oh, look, we actually reduced the deficit, which was based on some phony accounting. So these enhanced subsidies expire at the end of the year. And so Chuck Schumer and Democrats are now supposedly fighting to extend them or perhaps make them permanent. Now, Republicans do have a little bit of a political messaging problem because they feel they're always a little bit like a fish out of water when they talk about healthcare. And they're right now, if you listen to Speaker Mike Johnson, he's basically saying that, oh, well, we will be open to negotiating these in December, but let's just pass a CR right now, which isn't very auspicious for those who think that these subsidies were always a bad idea and have created all kinds of distortions in markets. But Chuck Schumer has a problem with the public, and he's I think I saw a poll showing he's the least popular congressional leader out of Mike Johnson, Joaquin Jeffries, and John Thune. And so he's really going to have to try to convince Americans why it is so important to shut down and keep the government shut down now over something that could be negotiated over during the next several months.
A couple thoughts here. One is that this is a play that you see run over and over again in politics, a temporary, sometimes an emergency policy, extending some government money, some government subsidy. And then as soon as the emergency ends, the argument becomes, well, you can't take that away from people. And so, I mean, no surprise, I think that this is where we are now with these pandemic enhanced Obamacare subsidies. On the politics, Kate, I do think that Alicia's onto something, that Democrats think they're fighting on some favorable terrain here. They think that they can win the argument on healthcare. And maybe part of that is because of what she mentions. Many Republicans are not out front making the policy arguments that this is not a good idea, that extending these kinds of subsidies has perverse incentives and creates distortions in healthcare markets. A lot of what you're hearing from Republicans is, at least so far, this is not a conversation we're going to have right now. We can have this conversation later. This is about funding the government at current levels and then getting into longer conversations about policy. Maybe we'll have that fight in December. But Kate, I think that maybe puts them at a disadvantage if they are not going to meet Chuck Schumer where he is in his rhetoric about this coming healthcare emergency that is facing millions of Americans. So what is the policy case on these Obamacare subsidies?
Well, I think we're right to distill, the interesting parts of this shutdown are, the Democratic identity issue, and as they try to organize around Trump and oppose him, and also was really a policy and intellectual test for Republicans on whether they're going to cave to Democratic demands that they spend about $500 billion over 10 years on a big transfer to health insurers. And so one thing I would really want to put on the bulletin board about these subsidies, people here, Democrats have done a really good job at shaping the environment around healthcare and making the public think that they're the party that gives people health insurance and that the Republicans are the mean people who want to take it away. And so when we talk about Obamacare subsidies and what's expiring, these are emergency credits for a pandemic that ended 2.5 years ago. I went through some data. If they expire at the end of the year, a person who's at 100% of the federal poverty line would then need to pay about $3.45 a week for a premium for a silver middle of the road Obamacare plan. Do you think it's reasonable to ask someone to spend $3.50 a week on a premium for a taxpayer underwritten health plan where taxpayers are still picking up well above 90% of that tab, that all they're being exposed to is that $3.50 that I just mentioned? And I think Republicans could make that argument, but are nervous to do so. The other thing I'd mention, some of the issues in these Obamacare subsidies really boil down to just in better political time, it would just be a bipartisan embarrassment that we set up this system that is not functioning very well, that is not giving people access to good doctors, and we just keep shoveling more and more money into it. And an example of that is that these credits basically put a bunch of people into health plans that were completely free. And of those people who were in these plans that they paid nothing for, 40% of them last year didn't have a single claim. They didn't pick up a prescription. They didn't go visit a doctor. Why is that? The left would tell you, well, that's just because these are young people who aren't using their insurance, but they need it if they end up sick or need a doctor. That is just not the case. I mean, if you look at the growth in these free plans has about doubled the growth of people under 35 in the ObamaCare exchanges. So what that means is you have tons of people flooding onto the exchanges who they may not know they're enrolled, they may have moved to a different state, they're not using this insurance or making claims on it, but an insurer is still getting paid for it. I mean, who supports that? What is the policy case for that? There really isn't one, but you don't have Republicans out there putting these facts up, making these arguments. You instead have really a growing faction of Republicans who say, let's just write the ransom check to Democrats so that we don't have to talk about healthcare, or we don't have to go into an election year with bad ads coming on about premiums going up.
Another piece of this argument is the effect that these kinds of free plans have on the rest of the insurance market. Some estimates floating around there from analysts that enhanced subsidies might lower the number of people who are covered by employer-sponsored insurance by something like 4 million. And Alicia, again, the Democratic Party and the left don't seem to mind that because often they think that more government coverage is better. It is a pathway to something like the single option, the Medicare for all, the single payer healthcare that a huge chunk of the party seems to want. But if you look at the polling, many people who have private insurance are very happy with it. And so that's another line that I think Republicans could go after here, is this kind of stealth effort to, over time, shift more and more of the insurance market all the time onto a government system and off of a private system.
Right. So this is kind of a halfway house between the ACA exchanges, or the Obama exchanges, were really intended to be a halfway house between kind of national or socialistic healthcare, a Medicare for all, and what had been the status quo. Now, these ACA plans, or the Obamacare plans, are very tightly regulated. And that's one of the reasons why they are also enormously expensive. There are all kinds of rules about essential benefits, how much you can charge younger people or versus older people, so which actually results in higher premiums for younger people than older people, or comparative to what would be the case if there was natural underwriting. One other point is that they also have encouraged or helped encourage, more consolidation. Obamacare in general has in the space, which has given providers more leverage actually with insurers, and actually in some cases providers have consolidated with insurers groups, and there's just a lot less transparency in prices. The private, this is where you get all this frustration about drug, the insurance companies and healthcare costs and all that. And a lot of it is because of these distortions that Obamacare created, which are really most apparent in the Obamacare exchanges. What essentially is happening is taxpayers are underwriting overpriced plans, expensive plans for many people who don't need them. And Kate points out to some numbers about how 40% of people who do not, who are enrolled in these plans didn't have any claims. And the likely reason is because they were probably enrolled without their knowing. There's been a lot of fraud with insurance brokers, and many of these people actually have access or maybe enrolled in employer plans at the same time. There's been some studies that are at the Center for Medicare and Medicaid Services that actually found about 1.6 million Americans were enrolled in both Medicaid and the subsidized Obamacare plans. So essentially taxpayers were paying twice. It actually even gets worse. Brian Blaze at the Paragon Health Institute has found that 6.4 million people were improperly enrolled, at least in these exchange plans. So that's almost like a quarter of the enrollment. The reason, as you point out, the Democrats have continued to promote these plans is one, there's more government control and regulation of that. And they see it as a way to eventually move toward a Medicare for all system, in which right now some of the ideas being floated out there or have been floated out there as well. These will, we can essentially make these free plans, expand them to everyone who is under, 65 or 55 or something like that, and make it a little more like Medicare Advantage. Though, of course, there's that little contradiction that the Democrats also hate Medicare Advantage because it has some kind of private competition. But the broader point is that Democrats do want to expand government control over healthcare. And they've kind of made this Faustian bargain with the insurers that, the government will have more power and will be able to dictate de facto the profits through regulations of the insurers. But in return, government is going to force people to buy expensive plans with all kinds of bells and whistles that they don't need.
Another part of the argument over healthcare, and where Democrats might think they have Republicans at a disadvantage, they have also called for reversing some of the changes to Medicaid that were passed as part of the One Big Beautiful Bill. But it might just be helpful as a reminder while this debate is shaping up. What were those Medicaid changes, and why did Republicans do those?
Well, I do think that is a core piece of this, and the irrationality of the Democratic strategy was that their opening offer was $1.5 trillion in new government spending and repealing the core of the big bill that Trump signed earlier this year. I mean, that was never going to happen if they had done something more savvy and tried to negotiate more on just specifically the Obamacare subsidies. You do have some Republicans who are so nervous they're at least open to maybe putting the income cap back on the subsidy, but, quote, reforming them in some ways. That might have been a savvier play for Democrats. To your question about the big budget bill, I think there is also some nervousness in the GOP conference about defending those changes that'll go through, but that there is a bad argument going around that, ratifying the Obamacare subsidies will act as some kind of political insurance to the inevitable attack ads that are coming in 2026. And I think that's very silly to imagine that Republicans can avoid that. They need to address it. And so to your question about reconciliation, I mean, one of the core changes was a work requirement in Medicaid that just simply asks folks to work or be in training or education at least 20 hours a week. So that's just part-time in exchange for taxpayer health insurance. I think it's a very reasonable work requirement. I think that some states are eager to set it up because their Medicaid rolls have grown so quickly that they want to get control of them. And you also had, one funny thing about the shutdown is that, Democrats want to repeal everything that Republicans did, including a $50 billion rural hospital fund that Republicans set up. I don't think that fund was a good idea. I think Republicans were looking for political cover when they passed that. But Democrats are so confused now that they want to repeal that too and throw it out, even as they also complain about rural hospitals. So it's a mess here on both sides. But I think Republicans have a very strong case that they made very reasonable changes to the Medicaid program, including those work requirements that I just described, and that they didn't even change some of the more fundamental features of Medicaid that still need fixing, like the fact that it pays more for able-bodied men under Obamacare than it does for pregnant women and disabled and children. So they have a reasonable case there that they can make should they decide to do that.
Thank you, Kate and Alicia. Thank you all for listening. You can email us at pwpodcast@wsj.com. If you like the show, please hit that subscribe button, and we'll be back tomorrow with another edition of Potomac Watch.